Good afternoon, everyone, again. So we are happy to be back with you and thank you for being with us. Those who have just joined us, welcome. And those who are here with us before the lunch break, thank you once again for staying with us. I am Jahera Wangari. I am a program officer with the Disability Rights Unit and a PhD candidate at the Center for Human Rights. And I will be your moderator for this session. And our rapporteur for this session will be Mr. Jalil, who is an alumni of the LLM MPhil Disability Rights Africa program. As a reminder, please feel free to engage with the panelists and fellow participants in the chat and post your questions in the question and answer section. We have international sign language and simultaneous French interpretation. For our presenters, please pace yourselves to ensure that our deaf and hearing impaired participants can follow your presentation. We are also live streaming on Facebook and the Center for Human Rights Twitter accounts. Feel free to share these as well. As a point of note and a follow-up from the very brilliant presentation we had before lunch from Miriam Zenge, tomorrow on Thursday, the 18th, from 9 a.m. to 12 noon South African time, we will be hosting a ratification workshop on the protocol of the African Charter on the human and people's rights, on the rights of persons with disabilities in Africa. So, and the link will be posted in the chat section. Also, please sign up and join us, then we can have even more engagement on that particular conversation tomorrow. So for our speakers this afternoon in our session, the theme is sexuality education, and we have two presentations. Our first presentation is by three co-authors, and the first one is Dr. Kenneth Muzata, Professor Beatrice Matafwali, and Professor Sophie Kasonde from the Department of Educational Psychology, Sociology and Special Education at the University of Zambia. Dr. Kenneth is the current head of department and holds a PhD in education from the University of South Africa, amongst other accreditations, and is widely published. Professor Beatrice Matafwali has over 15 years as an educator, researcher, and trainer. She is published in the areas of early childhood education, child assessment, and learning disabilities. The third co-author is Professor Sophie Kasonde, who has a long-running career as a researcher, supervisor, lecturer in educational psychology. She is widely published, including a book titled Writing Research in Education Research. Our second presentation during this session under this theme will be by Ms. Tinam Timbu and Ms. Vilaine Holness. Ms. Tina is an avid researcher with keen interest in impact litigation, the right to inclusive education, and sexual and reproductive rights of persons with disabilities. She has an LLM specializing in childcare and protection from the University of KwaZulu-Natal. Ms. Ntembu was born with cerebral palsy and visual impairment. Ms. Vilaine is a disability activist and senior lecturer at University of KwaZulu-Natal. Her doctoral dissertation with the Center for Human Rights focused on access to justice for mothers with intellectual disabilities in 2 KwaZulu-Natal children's courts. It's a pleasure to have you join us again, Ms. Vilaine. And you can find the more elaborate bios in the chat section. So on to our first presenters for this section. I will please ask Dr. Kenneth and your team to please proceed and please introduce your topic as well. You have 20 minutes and look out for me raising my hand at some point to signal your 5 minutes remaining. Can you spotlight the first presenter? Kindly bear with us as we figure this part out. The team kindly advise if the first team is ready to present, or we may proceed to the second presentation.
Jahira, may I suggest that you start with the second presentation, and then while we try and sort out the sound issues with the first presentation, please.
Okay. Miss Tina and Villain, are either of you online for your presentation, and might you be ready for your presentation? I know we would be ambushing you at this point.
Sorry, Taruna, may you please allow Valine to share her video and unmute herself, please?
Hello, yes. It's lovely to be here today. I believe that Ms. Timbu is going to do our presentation, so I'm waiting for her to come online, and she will take over from me at that point. If we'll just see for a moment.
Ms. Timbu is online.
Okay, so Tina, as soon as you're able to come online, you can take over. In the meantime,
hello? Can you hear me?
can hear you well.
Can you hear me well?
Yes.
Okay, sorry, I was having a bit of a technical issue, but I am back.
Wonderful.
Okay. Ooh, I'm still having a bit of a technical issue. Can I just open my PowerPoint so that I can share the screen?
Alternatively, I'll share the PowerPoint if you prefer, Tina.
Oh, that would be great. Could you share the PowerPoint and then I could just start presenting?
I'll do so. You can start. I will try also from my side to see why it is not working.
I'm so sorry. It's opening. It's opening. It's opening. Yes, got it. Share screen. Here it is. Okay. Can everybody see me?
No, Tina, perhaps you need to be spotlighted instead of myself. But they can hear you, so perhaps you can start while they get the video ready.
Okay, can everybody see me?
Go right ahead, Tina. Thank you. We can see you.
Okay, thank you, Valine. Just a little technical issue. Okay. Good afternoon, everyone. I'm sorry for such an erratic start. My name is Tinam Timbu, and today I will be presenting this paper on behalf of myself and Mrs. Valine Holmes. And the topic for our paper is the criteria for law reform on comprehensive sexuality education for children with disabilities in South Africa. Now, evidence shows us that young people in South Africa, including children with disabilities, are sexually active. But evidence also tells us that they lack access to comprehensive sexuality education. And while it can be argued that most young people are likely to experience some sort of barrier, we argue that children with disabilities are likely to experience additional barriers on account of their disability. Now, South Africa currently recognizes CSE as an appropriate curriculum tool for bridging the apparent knowledge gap between the rights and legislative system and the information in its sex education curriculum. But unfortunately, it seems that once again, children with disabilities are on the outside looking in, because the current curriculum and its recent developments are silent on sexuality and the disabled. We argue that more needs to be done to realize that to come alive to the fact that children with disabilities are actually sexual beings as well. Now, South Africa has actually domesticated quite a number of obligations that recognize the promotion and protection of sexual and reproductive health rights. And while South Africa can be commended for its efforts in recognizing children with disabilities as rights-bearing citizens, unfortunately, their efforts in as far as promoting accessibility to these sexual and reproductive health rights and the associated information thereto leaves much to be desired. And this is despite the fact that myths and taboos and skepticisms continue to be a real threat to young South Africans, or rather young South Africans with disabilities, actually exercising these rights. Now, if we look at I'm so sorry. Now, still with the technical difficulties, I'm so sorry. Can everybody still see my screen?
Yes, Tina, go ahead with your next slide.
I'm trying to open my next slide, but it doesn't want to cooperate. Could you perhaps share the screen for me, Valine?
I will try to do that. So you stop the share on your side and then continue with your presentation, and I will do it in the background, all right?
Okay, thank you so much. Now, moving on to, I'm so, right, okay. So, but before we actually talk about South Africa's sort of approach to CSE, let us consider first and foremost, what exactly is comprehensive sexuality education? And comprehensive sexuality education is a curriculum-based process of teaching and learning about the cognitive, emotional, physical, and social aspects of sexuality. It aims to equip children and young people with knowledge, skills, and attitudes and values that will empower them to realize their health, well-being, and dignity, develop respectful social and sexual relationships, and consider how their choices affect not only their own well-being, but that of others as well. And of course, understand and ensure the protection of their rights throughout their lives. Now, if we look at the international arena, one can immediately ascertain that there is currently no specific right to comprehensive sexuality education, which for the duration of this presentation, I would refer to as CSE, except of course in the African Disability Protocol, and as many previous speakers have identified, it is yet to actually come into effect. However, Wholeness and myself assert that you can actually infer a right to CSE by looking at a number of already established and recognized rights in international law. And these include the right to health, education and information, non-discrimination, equality, and of course, sexual and reproductive health rights. Now, treaty monitoring bodies have also played a crucial role in as far as providing interpretive guidance. And here I have, on this slide here, I have 3 excerpts that I've taken from general comments from a few treaty monitoring bodies. And as you can see, in its 3rd general comment, the CRC committee said that states should refrain from censoring, withholding, or intentionally misrepresenting health-related information, including sexual education and information, and that state parties must ensure that children have the ability to acquire the knowledge and skills to protect themselves and others as they begin to express their sexuality. Similarly, the CRPD committee in its 4th general comment said persons with disabilities on an equal basis with others must be provided with age-appropriate, comprehensive, and inclusive sexuality education based on scientific evidence and human rights standards. Now, in this final one, we had the CEDAW treaty monitoring body and the CRC treaty monitoring body come together. And interestingly enough, they found a place for CSE even in something as contentious. I don't know if contentious is the right word, but harmful cultural practices are a big issue in the African region, and not just South Africa only. But these 2 treaty monitoring bodies actually found a place for CSE in this particular area when they said that states are obligated to ensure that children have access to accurate information about sexual and reproductive health and rights, and on the impacts of harmful cultural practices, as well as access to adequate and confidential services and age-appropriate education, which includes science-based information on sexual and reproductive health. Now this one is very interesting. This is a publication from UNESCO entitled The Technical Guidance on Sexuality Education. Now, this was the first time we were actually able to see a form of criteria as to what ideally CSE should look like. It doesn't really prescribe a curriculum, but rather it tells us what CSE should encompass. And what I've done on this slide in particular is that I have provided the criteria. As you can see, we have phrases like scientifically accurate. So CSE should be scientifically accurate, incremental, age and developmentally appropriate, curriculum-based, comprehensive, based on a human rights approach, based on gender equality, culturally relevant, and context appropriate, transformative, and able to develop, of course, life skills needed to support healthy choices. Now, this criteria is, of course, fantastic, but I'm sure many of you are feeling that maybe there's a bit of a lack of disability-specific criteria, and you would be correct. So myself and Valine found that disability-specific criteria was absent from the UNESCO criteria. And when we're talking about disability-specific criteria, we're talking about things like inclusivity, accessibility, adaptability, and reasonable accommodation. And I must say, inclusivity is the one that stands out for me the most because, as was mentioned in my bio, I was born with cerebral palsy. And so I have been exposed to the sex education being provided in schools. And I must tell you that representation is absent, absolutely absent. So you never really see or read anything about persons with disability being sexually active in any way or exploring their sexuality even in any way. Also, in all we really have at our disposal is what is being provided from the able-bodied perspective. And then you just have to sort of take that information and forge your way forward as you try and discover who you are sexually as a person. Now that we have discussed the sort of international arena, we are going to delve into what South Africa has to say about, or rather South Africa's stance on comprehensive sexuality education. We're going to first look at the Constitution, which of course is always the primary basis of any legal discussion when it comes to law in South Africa. And according to section 12.2, which is the right to bodily integrity, everyone has the right to bodily and psychological integrity, which includes the right to make decisions concerning reproduction. This right recognizes at a minimum that each physical body is of equal worth and entitled to equal respect. The right to bodily integrity ensures that all persons, including children, have the right to autonomy and self-determination over their own bodies, and considers any unwarranted intrusion a violation of human rights. Moving on to the South African Schools Act. The South African Schools Act doesn't really speak to the curriculum, but it does tell us how schools should conduct themselves. And according to the South African Schools Act, all public schools must admit learners and serve their educational requirements without unfairly discriminating against them. The Act somewhat recognizes accessibility by saying that schools must serve educational needs whenever it is reasonably practicable. But unfortunately, it doesn't really talk about the importance of reasonable accommodation. Instead, it creates a defense whereby schools can then say that to cater for this learner, let's say that the learner had special needs, they could then say that catering to this learner would be beyond being reasonably practicable. Moving on to the National Education Policy. The National Education Policy does somewhat speak to curriculum because it talks about how the curriculum should really promote democracy and human rights, and also recognize and respect rights that are already afforded to children in international conventions. It goes on to talk about how the curriculum should contribute to the overall development of a student. And so from these provisions, Wholeness and myself were able to assert that one could infer that there was room for the provision of CSE within this particular act. And then finally, looking at the Children's Act, which of course is the primary legal framework for the realization of children's rights in South Africa. It is a pretty long act, but we will only be looking at two sections, namely Section 11 and Section 13. Section 11 of the Act affords children with disabilities and chronic illnesses, amongst other things, the opportunity to participate in educational activities in a manner that is cognizant of their special needs. The section further states that it is equally important to provide children with disabilities with conditions that ensure dignity, promote self-reliance, and facilitate active participation in the community. And then finally, Section 13 of the Children's Act grants children the right to access information related to health and promotion, and the prevention and treatment of ill health, disease, sexuality, and reproduction. The section also recognizes the importance of accessibility by again emphasizing that this information should be cognizant of any special needs that a child may have. Moving swiftly on to the policy framework, I would like, for the constraints of time, to combine the National Policy on HIV, AIDS and STIs and TB, and the National Adolescent Sexual and Reproductive Health and Rights Framework, because quintessentially they say the same thing. The two policies recognize CSE, and they actually go as far as describing them as a game changer. But unfortunately, although they realized that children with disabilities would benefit from CSE, they don't elaborate further as to how they would be represented nor accommodated in the curriculum. The National Curriculum Statement speaks to how CSE is currently governed in South Africa today, because CSE is provided through a subject known as life orientation. And if you read this particular policy, you quickly learn that in the curriculum, they talk about issues such as teenage pregnancy, disease, employment, and physical education. But the policy then goes on to talk about how it is sensitive to issues of disability. But if you read further, you actually realize that they do not talk about disability beyond the context of non-discrimination. So again, we go back to that issue of lack of representation. They don't even talk about discrimination and how perhaps it would affect children with disabilities differently than it would affect their non-disabled peers. Finally, I would like to consider the white paper on the rights of persons with, oh, sorry, I forgot to mention white paper 6. White paper 6 does not speak directly to CSE. Instead, it does highlight rather the importance of inclusivity by noting that all children are educable provided that they are given the necessary support. The policy also identifies that curriculum could possibly be a barrier to one's learning. But the last policy we're going to consider is the white paper on the rights of persons with disabilities. This policy is relatively new. I think it's from 2015. The white paper, here it is. So it aims to reflect the already established fundamental values of the CRPD in policy and proposes a collaborative multi-sectoral approach involving all relevant stakeholders to effect the necessary changes needed to transform the lived experiences of persons with disabilities. In relation to CSE, the policy does make mention of the provision of sex education, but unfortunately, it only speaks about it in the context of HIV/AIDS. Furthermore, the policy suggests that the school curriculum could be used to address sort of the negative stereotypes around disability that are currently prevalent in South Africa. The policy further emphasizes important issues such as supported decision-making and self-representation. And this, I feel, is very important, as many of the speakers, including Mrs. Holness herself, have said. Sometimes when dealing with persons with disabilities, it seems easier rather to substitute what the person may have wanted for what would make the life of the parent or the caregiver or whoever is dealing with the particular person with a disability. It's so much easier to then substitute what you would prefer to make your life easier as a caregiver instead of actually taking the time to help and support the person with a disability make a decision that better represents what they would have wanted in the first place. And although the policy is yet to reach authoritative legislative status in South Africa, its contribution to the disability rights movement cannot be denied. However, to avoid reading like a political symbol, Holmes and I assert that more needs to be done to expedite the concretizing process, or rather, we need to expedite turning this policy into enforceable legislation. And of course, this policy, Holmes and I found that it would be the best vehicle for the provision of comprehensive sexuality education, especially since South Africa is currently in the process of drafting a disability-centric bill based on this particular policy. Now, if we look at the fundamental flaws and shortcomings of South Africa's approach, it appears to be, first and foremost, it appears to be a tick box approach. And what we mean by this is that it seems to be something where you can kind of claim inclusivity without really having to elaborate any further. As you saw with the first two policies, the TB, STI, and HIV policy and the adolescent framework, both those policies I mentioned spoke about the importance of CSE and how it would benefit children with disabilities, but there was no further elaboration on how they would be represented or accommodated. And then as a whole, it is fragmented. I mean, we had to look at 4 different pieces of legislation and 5 different policies to kind of piece together South Africa's approach to CSE. And it is incoherent in relation to sexual and reproductive health rights of children and youth with disabilities. And like I said earlier, there is a lack of representation. Explicit provision and of course an explicit provision for accessibility to CSE is absent. And finally, there is an implementation delay in the legislative framework, which means that there is currently no concrete provision for CSE, both in schools and in out-of-school facilities such as clinics and special care homes and juvenile centers, etc. Finally, it's the recommendations. Holness and I recommend policy reform in all sectors, including education, justice, health, and social services, to strengthen the provision of sexual and reproductive health rights to children with disabilities, including CSE, in and out of school. Because we must remember that, yes?
Would you please pause so that we spotlight the sign language interpreter? I know you're just wrapping up, but just a moment, please.
Okay. Tell me when I can continue.
Yes, you may continue.
Okay, thank you. We were talking about the recommendations. Holness and myself recommend policy reform rather in all sectors, including education, justice, health, and social services, to strengthen provision of sexual and reproductive health rights to children with disabilities, including CSE, in and out of schools. Because we must be cognizant of the fact that not all children with disabilities are actually in school. And so it's important that CSE be allowed to exist outside of the context of school, and in places such as juvenile centers and special care centers, etc. Of course, legislative amendment requires, this I think is similar to what I just said, is that legislative amendment requires application in non-school settings as well. Because like I said, we must be cognizant of the fact that not all children with disabilities are afforded the opportunity to go to school. And then, of course, I spoke earlier about how the South African Law Reform Commission is currently developing a draft disability bill. And so, like we said then, this bill, or this piece of legislation rather, would be the perfect vehicle for a legally enforceable obligation whereby South Africa is obligated to provide CSE. But it's also important to be cognizant of the fact that disabilities present themselves in different ways. So the legislation would obviously have to have provisions talking about how the curriculum should be modified into alternative formats, including Braille and easy read, so that it was accessible to a variety of disabilities. And then, of course, it should incorporate general principles such as non-discrimination, the recognition of legal capacity, accessibility, and reasonable accommodation, which would then act as a framework for other enabling legislation and policy. And then finally, we recommend an amendment to the Children's Act, which we spoke about earlier, that includes an explicit provision to for CSE rather. We actually have a slide. If I can just, yes.
Could we maybe leave it at that, because we're quite over time, and then we will share the slides. Sorry
okay.
I know we did have a bit of mix up at the beginning.
Okay, but this would be that was the final slide. Thank you so much.
Thank you so very much for your presentation. I think it really offered questions that were coming up in previous presentations since yesterday. So thank you for that. And now, without much ado, Dr. Kenneth, are you ready to present?
Okay, so thank you very much. We've had an immediate power outage here, so it wasn't that easy. Panicking, trying to find ways of how I can actually present. So I would love to share the screen. Although I'm told host has disabled participant screen sharing.
You can share now.
You can try now.
Pardon?
You can share now. Please confirm.
Still tells me the same.
Please try one more time.
Okay, thank you. So now it can agree. Hopefully you are able to see something there.
Yes, we can.
Okay, great. So now, and I hope I'm clear. So obstacles to the acquisition of comprehensive sexuality education skills among learners with disabilities in Zambia. Okay, Kenneth Mzata, myself, I'm with Beatrice Matafwali. That's Professor Beatrice Matafwali and Sophie Kasondengandu, both professors. So we conducted a study with UNESCO. Let me just disable this. Okay, because of the phone where I was, so it was also on, so it was disturbing me with echoes. Now that I've regained connectivity, I must use one gadget for this presentation. Okay. So I was saying we did this study with UNESCO in 5 countries, of course, but then we thought we could sieve out a few things that require qualitative understanding and find out really what the obstacles in depth are from a qualitative perspective, and perhaps we can understand them from the contextual situation as it pertains to Zambia. So we're saying, generally there is an agreement that comprehensive sexuality should be taught in schools. Globally, there is this general agreement. Yes, we've seen the value that comprehensive sexuality education can empower young people with knowledge and skills so that they can counter the social evils in society. Okay, so a right-driven agenda that is influenced by issues that have occurred in society, such as child abuse, sometimes ignorance about reproductive health issues, among others. Okay, so this is recognized also by UNESCO that sexuality education should actually cover issues of sexual and reproductive anatomy, physiology, puberty, menstruation, reproductive, contraceptions, pregnancy, childbirth, sexually transmitted, diseases such as HIV and AIDS. These should be taught over a lengthened period of time to learners so that they are able to actually counter the social evils that exist in our society. Now, comprehensive sexuality education definitely is not about sex. It's beyond that. So it's beyond understanding one's, well-being. So the term comprehensive sexuality education has to do with the breadth and the depth of what should be taught, how it should be taught, and how consistent the content should actually be delivered to learners over time. At the end of the day, when a learner, matures and joins an independent society, joins society as an independent individual, they should be able to take care of themselves, make appropriate decisions regarding their own sexuality, regarding their human rights, health, and having interpersonal relationships, respectful, family life, adapting to social norms of their own society, living in a community where there's non-discrimination, and able to actually engage in sexual behavior that is consented, free of violence and gender-based, activities. Those are issues that have been enshrined in UNESCO 2017. Okay, so Zambia equally is one of those countries that has actually adopted this practice to say comprehensive sexuality should be taught in schools. So our curriculum equips learners with knowledge, skills, values, and positive attitudes about reproductive health. That is embedded in the Ministry of Education 2013 curriculum. Okay, so now, let me just move this. Okay. So I'll put this one down. Okay, thank you. Yeah, so the curriculum 2013, which we are still, using, appreciates that learners should be helped to understand the functions of their bodies, know how to handle issues of sexuality, and these issues, as itemized in the Zambian curriculum framework, include the understanding of puberty, the menstrual cycle, social desires to be more independent, being with friends, attention to others, to own appearance, romantic feelings and dating. How does one handle such? Under emotional, how does one handle, mood issues, physical and internal issues affecting the individual? Then issues to do with menstruation, ejaculation, enlargement of, testicles, breasts. These issues have been included in the MISTIV, that's Ministry of Science, Vocational and Education Training 2014 curriculum framework as well. That was okay. So now, so we conducted a study whose objectives were basically qualitative, that we examine the attitudes towards the implementation of, comprehensive sexuality education, especially for learners with special education needs in Zambian schools, special and inclusive schools. And that also we provide an in-depth description of the main obstacles to the implementation of CSEs to learners with the disabilities. Now, this comes from a background that there was some kind of resistance from the general community about the introduction of comprehensive sexuality education, generally in schools. But a gap was observed that we didn't actually have any studies conducted that specifically focused on this acquisition of these skills or the implementation of comprehensive sexuality education to particularly learners with the different disabilities. Yet, these learners are supposed to follow the same curriculum, though adapted, modified, and accommodated to their needs. But at the time of the study, we had not seen this being implemented in the schools. So that was a source of concern, that learners with disabilities equally needed to have access to CSE, content, information, skills, knowledge, and practices. Hence, that is how we actually thought of conducting that particular study. Yes, like I've already stated, literature review, yes, limited studies so far, more still needs to be explored. Of course, the lack of accurate information leaves young people with disabilities vulnerable to sexual victimization. That is by CI Seekers 2021. Definitely everybody would agree that when you have no information, you are likely to be abused and you cannot defend yourself. So we are usually, as human beings, ladies especially in most cases, viewed as sexual objects, and issues of being viewed as a sex offender, all those lead to difficulties in achieving some kind of health relationships that one may actually desire. So that's literature. Other forms, pieces of literature point to culture, religion being, factors that inhibit the teaching of comprehensive sexuality education. Also, community resistance has also been noted in some areas, and poor training of, teachers. Also, culture, financing, inadequate financing of these programs also becomes one of those, challenges. Also, the overwhelmed curriculum, burdening teachers, there are these issues of wanting to have this particular component be taught as a subject on its own. So with this particular literature, we are saying perhaps we are more on the quantification part. And so we may not be understanding more in depth the actual things that affect, the implementation of comprehensive sexuality education in schools. And that requires to be understood. For as long as we ignore the qualitative, the context of the people that, implement these programs in the school, the recipients of these programs, from the qualitative point of view, we will be failing to solve the problem. All we will be doing is, okay, 70% of the teachers said this and said, therefore the problem exists, without understanding actually that the problems are more embedded in the cultural context of the people themselves. Okay, so the methodology was purely, qualitative, borrowing from the phenomenological design. We involved, college lecturers 4, school teachers 15 through interviews, and focus group discussions 7 for learners, and focus group discussions for parents, and key informant interviews within the Ministry of Education 14. So we had focus groups, discussions, and interviews conducted to simply create an understanding of what really affects the implementation of comprehensive sexuality education in school. So 4 provinces were involved, yes, and we used a 5-step framework analysis to just analyze the data and provide our conclusions. Now, a summary of the findings shows that from the attitudes perspective, we can see from the slide that the college lecturers were quite positive. The school teachers also were quite positive about teaching, comprehensive sexuality education, but raising a few apprehensions here and there in terms of the teaching. Now, these are school teachers who are actually within the classroom itself. And if they are rated at moderate, meaning they have apprehensions about teaching comprehensive sexuality education, then you must already be seeing that there could be a hindrance in terms of how best learners can actually acquire the skills we desire them to acquire in comprehensive sexuality education. The learners themselves, surprisingly, were more positive. These were learners with disabilities, by the way. So they were more positive and absolutely positive about learning this. They really have no issues. And so probably we can say the problems that affect the implementation lie more outside the learner himself, who is actually supposed to be the most determinant of what he or she should actually learn than determining for them what they should learn. Okay, so parents were more on the negative side. Key informants, these who included, ministry officials at different levels, provincial, district, and so on, school level. These ones were more positive, but a few apprehensions here and there, except the density of coding shows that they were more on the positive side. Okay, so now, why we took the qualitative perspective and the reason that we need to understand more in depth what really goes on and how it actually affects. We can accept as teachers, for example, to say we are teaching comprehensive sexuality. It's a policy, we teach it. But does the learner really go in does the teacher really go in the classroom and teach the way the policy has dictated to him? Does the teacher go in the class to teach the way the syllabus has dictated to him? Or there are more other things that actually go in class that make the teachers avoid and fail to deliver the actual skills, the actual knowledge that these learners are supposed to acquire in the classroom. I hope my interpreter is with me, or I'm too fast. Okay, great, thank you.
You just need to wrap up. You have 1 more minute, please wind up. 1
more minute, thank you.
Yeah.
So the positive views, we had the positive views. Why the positive views? There are these, sentiments that were coming that we need to teach this, of course, because the learners are vulnerable, and also that the learners usually are abused in schools or even outside schools, sometimes even at home, and sometimes even by close relatives. And also verbatims that are talking about, that these learners should be taught because they are also vulnerable to diseases, sexually transmitted diseases. Okay, so yes, some of them don't report even, and so they need to be provided with assertive skills to be able to report the experiences they actually, go through. And that they also get involved in sex that some people think that persons with disabilities do not. But even if they get involved in this sex, they do not actually understand their bodies and what may actually occur after they have gotten engaged in sex. So the reason that we should be able to actually teach them. So to think that young people don't engage in these activities is actually to leave them more vulnerable to the dangers that come with the engagement in sexual activities. So there were other reasons, of course, protection against diseases and planned pregnancies, defeating myths, also that it is also a moral responsibility. But the indigenous knowledge part has to come in on how we should be able to teach these learners using our indigenous skills, that we are going too more Western in trying to force things that we should teach them this and how we should teach them using the methodologies that are actually borrowed, ignoring that in our culture, actually, our grandparents, the aunts are the ones that actually were responsible for teaching sexual-related issues to children that are actually coming of age. Now we are forcing a teacher in the classroom to teach this same content that he feels very uncomfortable. So the issue is, why don't we blend our teaching approaches by bringing in several stakeholders? Because what has brought this particular uproar is the issue of traditional leaders, religious leaders saying what you are teaching these children is actually not appropriate. You are teaching them to be aware about sex, and therefore they will engage in sex when they are actually not ready. So the issues, okay?
My greatest apologies. I will have to cut you short because we have already eaten into the break. If you will please allow me that we stop your presentation at that point so that we also allow time for questions from the audience.
Okay, so I've done 15 minutes. I was thinking that you gave more than 20 minutes. So
unfortunately, the afternoon session, apologies for that. We do have one more session before the closing session, and that's why we had to limit it quite a bit. But we will have a bit more time with the Q&A.
Okay, thank you. Thank you.
Yeah, and I feel like the first question might also be directed to you. That the findings that the parents are negative towards the comprehensive sexuality education perhaps suggest that the parents have to be equipped themselves somehow. There may be issues of being protective, and that's from Dlamini. And I want to build up on their question by asking, given that you're under the university and training teachers, so what do you see as the role and impact of training teachers in the delivery of CSE, in way of then the teachers themselves on learning the ableism and the notions of disability, given that they're also part of the wider society? And then we can take a question for Mrs. Mtembu. Please go ahead.
Okay, so you've asked questions already on the presentations?
Yes, to yours. You can respond and then I'll ask to the other presenters. Would you want me to repeat that?
Please do.
Okay, so we have a question from Dlamini, that the findings, what you have just shared, that the parents are negative towards comprehensive sexuality education, perhaps suggest that the parents have to be equipped themselves somehow because there may be issues of being protective. And I'm connecting that to my question about you being in a learning institution and you're training teachers. So how do you see is the role and the impact of training teachers in the delivery of comprehensive sexuality education? And how much are the teachers able to unlearn their notions of disability given that, these are also very key stakeholders in the delivery of CSE. Is that clear?
Okay, so the negative, perceptions by parents. It's quite understandable. That's why I'm, of course, I was struggling with my connectivity here to be able to catch up with time. But then at the end of the day, what we are saying is, in this particular presentation, when you will share it, you will certainly see where the biggest points of contention, which I think should have been presented, are the curriculum itself has talked about the age at which the key issues that I wanted to have them brought out are supposed to be presented. The parents themselves feel that in this particular context, a child of 11 years, for example, is too young to be presented with such kind of content. Now, I agree with Dlamini that parents need to be given the skills, and absolutely agree so, because the uproar mainly arose from lack of adequate consultation with the key stakeholders, and these include actually the parents themselves. But for learners with disabilities, what we know in the Zambian context is that most of them usually enroll in school age. So having comprehensive sexuality education provided to them while they are even still in primary school, actually, and parents need to actually know that, because by the time they are in school, some of them would have already developed full-grown, reproductive organs, and would already be starting to engage in sex. Some of them would even be, 15 years, 20 years in a secondary school, maybe grade 8, grade 9. So they are already quite grown, and parents need to actually understand that. So I very much agree that we need to teach the parents about that. But at the same time, we also need to accept the traditional cultures in which, these children, live, and the activities we give them so that they are able to help their children to learn. And I remember, for example, would you give a child, children with visual impairment, for example, would learn better by touch? I had something that I wanted to show there, learning by the sense of touch. If the child has to learn about or be aware of his body, and learning about his own body is by the sense of touch. Now, you can see that organ there, which we actually already know, and the child down there is actually saying, you have to learn, I thought I was still presenting, it's been put down, okay. So, in that particular case, you'd find that while the child wants to learn by touch, the traditional cultures do not actually agree to such kind of approaches. They wouldn't, a father or a mother would not teach the child to manipulate their own bodies. So who is supposed to do that? So the question is, how do we, build our curriculum so that we bring in the approaches that the traditional cultures have used and be, used in the school system as well, and in the training of teachers. Your second question, really one of those biggest challenges we also face. For us at teacher training level, we do not have bigger problems because comprehensive sexuality education has been taught through different subjects such as science, integrated science, and so on. So the issues of body morphology, menstrual cycle, they are not really an issue in the preparation of these teachers. But what is more of concern is how to teach this, especially using vernacular languages, where you have even accepted to use the so-called indigenous languages in implementing the curriculum. So there now, that is where it becomes a problem to actually mention the word penis in your vernacular language. It becomes a very big insult, for those that are listening to you. they also regard you as their own parent, and at the end of the day. But when you mention it is in English as penis, it is not an insult. So I think those are some of the issues that we will need to get around to be able to deliver comprehensive sexuality education effectively in the schools.
Yeah, no, thank you so very much for that. I'd want to have a chance to have just one question to Ms. Mtembu. And then we can have, I please encourage, I've seen a participant raising their hand. Please post your comment in the Q&A section, and Dr. Kenneth or your colleagues can please go ahead and respond to the same questions and engage further in the chat section of the Q&A section. And Ms. Mtembu, my question to you is more, it's more like the gaps that you have observed in the process of getting the white paper. What gap have you observed in the process of getting the white paper to the level of enforcement, and which stakeholders might be needing to be more engaged, like specifically because you're talking of, like even now with the Disability Act being in the process. So might you have like a short response to that?
Hello, can you hear me?
Yes, I can.
Or could you please repeat your question one last time?
What do you, hold up. So what gap have you observed in the process of getting the white paper to the level of enforcement? I'm sure you have already mentioned this in your presentation, but more specifically, which stakeholder might need to be more engaged in this process?
Okay. As with many policies in South Africa, most of them actually sound good on paper, but when it comes to implementation, something is always lacking. As to which key stakeholders could perhaps bring more to the table, I think there's no one specific stakeholder. I would say that there is a lack almost all around, from health providers to educators and everybody, because it seems to be like comprehensive sexuality education is all good and well, but no one is actually wanting to take the time to actually discuss or actually elaborate on how it would accommodate or represent persons with disabilities. I mean, in earlier discussions, we heard speakers talking about how health providers don't necessarily know how to handle issues with children with disabilities with a particular sensitivity. We also heard about how educators sometimes struggle with bridging the apparent knowledge gap because of things like culture and how much are you actually comfortable teaching the child. So as to who can bring more to the table, I think overall, because reform is needed all around, everyone could actually have something to learn in the context of comprehensive sexuality education, because like I said earlier, a key issue is representation. There is not enough representation. People seem to want to talk about CSE and the disabled, but no one really wants to give us details on how they are going to be accommodated or represented. I hope that answers your question.
It does. Thank you very much. And at this point, I want to apologize to all of us, all of you, that because we will not be having a health break, I'd like to hand over to my colleague, Tadiwa Nasha, to please take us on to the next session. And thank you for the presenters, all of you, those who presented and those who worked on the papers for this previous session. Thank you. And Tadiwa, please, over to you.
Thank you for that, Jahira. I'm just trying to turn on my video quickly. Okay, sorry for that mix-up. I will be appearing under Sabia's screen, so if you could please spotlight that. Great. Thank you very much. And that was an excellent session on sexuality education. I think we all learned a lot, and I could see that there were still a bit more questions. So we might have some time at the end for any questions that you might have. And again, apologies for not being able to continue to have a health break, but due to time constraints, we'll be moving on to the next plenary session, which is on intersections. I will be your moderator for this session. My name is Tadiwanashe Mavunga. I'm an intern with the Disability Rights Unit at the Center for Human Rights. Our first speaker will be Mr. Benedict Khumalo, and he will be discussing the intersection of race, homosexuality, disability, and focusing on exploring disabled, colored, and a gay man's narrative of identity and the deployment. And then our next speaker will be Ms. Mahotsi Letimile, and she is a disability and sexual rights enthusiast, and she will be giving her self-testimony. Mr. Benedict Khumalo is a disability researcher and a humanitarian with 3 postgraduate qualifications in social development and social anthropology from the University of Western Cape, and a postgraduate diploma in disability studies from the University of Cape Town. He is currently enrolled for an MPhil in disability studies at the University of Cape Town. His research interests include decolonizing spaces of learning and teaching for inclusive education from an African perspective, digital accessibility, and narrative of blind men's negotiation and constructions of masculinity within an African context. His MPhil research focuses on educators' perceptions of schools for visually impaired learners within an inclusive education system in South Africa, focusing on exploring the disconnect between policy and implementation. In 2020, he co-authored an article entitled Emotional and Embodied Aspects in the Education of Learners with Visual Impairment, the Use of the Standpoint panel chats in the teacher training in 2020. He is interested in reviewing websites and advising designers and developments about the universal accessibility and inclusion participation. Mahosi is a disabled sex worker, a reluctant activist, a mom, and a pleasure advocate for disabled women. She's an inclusivity consultant and a writer as well. And without taking up much of our time, I'd like to hand over right to our speakers. And our first speaker, as I've mentioned, will be Mr. Benedict Khumalo, discussing the intersectionality of race, homosexuality, and disability.
Afternoon, am I audible enough?
Yes.
Okay, I'm not sure, do I need to switch on my camera?
If possible, that would be great.
Oh, I think they said the host has stopped it.
Okay, I'll just ask the host if you could please enable Mr. Khumalo to please turn on his camera.
Unable to start video. You can't start your video because the host has stopped it. Window. Holder has left the meeting. Auburn Jalil Odun has left the meeting. Start video.
I think that should be fine now. I've requested for an assistant with the slide navigation. I'm not sure if anyone from
Apologies for that. I will be sharing the slides in a moment.
Okay. So would I need to tell you to move to the next slides, or they will just be on the screen, all of them?
Apologies for that inconvenience, Mr. Kumalo. I think if you can start speaking without the video, we're trying to sort out allowing you to share your video.
No problem. Yes, good afternoon, everyone. As you might have heard, my name is Benedict, and I am at the University of Cape Town. So I am doing a study about the intersection of race, homosexuality, and disability. I'm exploring a disabled colored gay men's narrative of identity and the deployment of sexuality. I think ever since the promulgation of our constitution in South Africa in 1996, which is more predicated on the human rights, I have been extremely fascinated by this human rightsness in relation to a disability. And then later on, through my sort of work, I've worked for an LGBT organization. So that also became part of my interest. So what I intend to do today is to present, I'm looking at the disconnect between this constitution and what is happening on the ground, and furthermore looking at how constructs of disability and homosexuality leave those with visual impairment. I'm not sure if now the slides are on. Okay, I'll just continue. So my interest is looking at what does this whole human rights and the constitution mean for persons with disability as well as the LGBTI persons. And to me, when I looked at it, as everybody's been saying, that it means that everyone is equal before the law, and no any form of discrimination could be expected. No form of any discrimination could be based on gender, race, disability, and sexuality could be expected, because everything, the law accommodate the human rights for all of us. However, when one looks at that constitution, I find a contradiction between our traditional constructs of disability, disabled people's sexuality, as well as the cultural practices of homosexuality. I'm sure we all know that in South Africa, homosexuality is still perceived, well, it's constitutionally, it's even legally, it's allowed, but in our cultural context, some cultures still don't think that, or they still perceive homosexuality as evil, or is still perceived, sorry about that, that's voice I was speaking, is still perceived as immoral, or to some degree un-African. The same again could be applied to disability. Sometimes disability is not always perceived as this a blessing. Some families in some cultures still perceived as being more of a curse or some sort. So I also looked at what does it mean? Where do we locate? How do we understand these two groups of peoples there, homosexuals and the disabled? So here I'm referring to our social constructs of disability as well as homosexuality. And as has been said even throughout the day, sorry about that, as we have been hearing throughout the day that from the ableist context, disability is still constructed as degendered or to some degree asexual, which some scholars have seen some form of how men with disabilities would renegotiate their masculinities, but in general, disability is perceived as more as a degendered person or a sexual person. At the same time, homosexuality is completely inconsistent with the African beliefs. Now, when one looks at this, it sounds to me as if disability and sexual and homosexuality are completely two different things, that one cannot be disabled and homosexual at the same time, which is not true. So my concern then was, where what is happening to people with disabilities who might be within the LGBTI group? And because there's not even enough research on this, my assumption was that they would be isolated, or they would feel lonely, depressed. And also, I think they should be at a higher risk of abuse, because nobody is saying anything, even within the education. When we talk about the education system earlier on, we don't necessarily talk about education from the LGBTIQ context. We normally talk about disability, sexuality as from the heteronormative perspective. We don't think of there could be other becomes be more worse when one is even more of a disabled person. So this is where the interest of my study came from, that as to now, if we would have a person who fall within this group, how then do they renegotiate their identities? What happens when one becomes a disabled and LGBT, or fall within the LGBTI persons? Because all of these two groups, as Durkan in 2002 developed a concept called homonormativity, where we tend to, because we live in a socially we construct the world the way we see it fit us. So from a homosexual homonormativity would be anyone who the homosexuals perceive as fitting their standard. It could be someone with a flamboyant or strong or very much masculine. Also, the same way with Paul Chappell developed also called a concept about disabled normativity. This is now where we talk about a person who fits in the status quo of being a disabled person. So I said, now, if one does not conform to this standard, how does one then renegotiate the identities? Bear in mind that there are other elements of our lives which shaped our identity. One here looks at age, a culture that we all grew up in, the religion that we believe in, because in all of this, we tend to exclude those who don't fit our status quo. So the purpose of my study basically was to look at a gay man's expression and negotiation of identity within the disabled community as well as the LGBTI community. How does he negotiate these two spaces? What could be some of the gaps or the challenge that he encountered? And also, is there anything that we could learn from his experience that will help us as the scholars or educationists when we do disability sexual education could
Hi, Mr. Kumalo, are you still with us? Mr. Kumalo, you are muted.
International Sign Language Interpreter. Unmute audio. Currently unmuted.
Am I audible now?
Yes, we can hear you now. You had muted yourself.
Okay. I'm not
Yes.
sure now where did I end up. I was speaking the whole time. Oh,
I think the last thing we heard was, you discussing your focus on your research and the focus on identity.
okay. Probably then it should be.
Yeah, we've also started sharing your slides. So if you can also just let me know which slide we should be sharing right now.
Okay, because I was already towards the end. Okay, then let's go to slides. Slide 5. If it's okay.
Okay, we're now showing slide 5 on social construction of sexuality.
Oh, it's up. So in my braille, it's supposed to be slide. Okay, but still okay. On my paper, it's slide 5, but it's okay.
Which slide would you like us to show?
No, the same one still okay. The social constructions of disability.
Okay.
So from here, as it's so there are two frames that I looked at disability construct, the ableist, as well as, and I looked at also the heteronormative perspectives. So from the ableist context, as we have heard during the course of the day, that people with disability were perceived or are perceived as degendered or asexual, although some scholars have tried to run away from that and try to see how particularly men with disabilities renegotiate their masculinities. But at the same time, homosexual, from a heteronormative perspective, disability, homosexuality is considered as inconsistent with African beliefs and practice. So they can go to slide 6 in yours, I think. And moderator, slide 6.
I've moved to slide 6 on assumptions.
Yep. So from here, it sounds to me as if we assume, or there's an assumption that disabled people cannot be homosexual or vice versa, which it's not true. Slide 7, moderator. And I think this is now where the crux of my paper came from, as to if there's a person who find themselves being a disabled and homosexual, where would where would they be at this present moment? Because we know that homosexuality is inconsistent with African beliefs and practice. Yet at the same time, people with disability are being perceived as asexual and degendered. And my conclusion was that they would be lonely or feel depressed. They are at high risk of abuse because no one would believe them, or that can't even share anything to anyone about their sexuality. Secondly, also, as we have heard about education and lack of education, so we don't necessarily have our current South African curriculum. It does, I think, have an element about homosexuality as within the education, but it does not say anything about disability and sexuality. So that on its own, people who identify as homosexual as well as disabled, they will lack that educational knowledge about their sexuality. Slide 8, moderator. So now the critical question that emerges is that now, how does one renegotiate the identity from these two normative spaces of homosexuality as well as disability? And there I have two concepts, homonormativity as well as disabled normativity. Those concepts, the first one came from Dagan in 2000, where I cautioned us about the standard that we people tend to do for any social construct. For instance, gay or the LGBTI, they would have a standard as to what qualifies a person to be an LGBT. So if you don't fit in that standard, for instance, if you are not young, or if you are poor or not good looking, you cannot be. And that on its own excludes those who are disabled or who might be poor. The same way with the disabled normativity, Paul Chappell came with that concept, and he also cautioned that the same way we kind of create a standard about what is ways, or what is the standard for being a disabled person, and that also exclude those who might not fit the status quo. It could be an LGBTI person or someone with epilepsy or any non-visual disability. Disability cannot be identified with our eyes, so those with dyslexia and so on. And then there are other elements of our identity that also shaped us, that we use to shape our identity, our age, class, and all of that. So I think for what I was more interested here is to look at how does all of this aspect help us to shape the person. And then as we move on to slide 9, moderator, which is now the purpose of my looking at taking what we have known so far, what I understood as to what are these binaries, and how then does one who does not conform to each only but have both of them as part of their being, how does a person renegotiate their identity, and also what sort of ways does he, of features that he used or implement to formulate him as a person who is he's colored and he's gay. So my interest was to look at, I use a narrative inquiry to hear his stories about his journey as a person who has been an LGBT. How did he manage to be himself? What were the challenges? How difficult was it to come out? And also, who did he even share his story with? Because he might experience homophobia from all in society as well as from the disabled community. And the last slide, moderator. I think the significance of my study, more than anything, is rather to add more knowledge to the body of sexuality and disability in general, because this part of research is barely done, which one can understand where Africa is as far as homosexuality and disability is concerned. So yeah, thank you so much for giving me the opportunity. moderator.
Thank you very much for that, Mr. Kumalo. I think we can all agree that was very insightful. Are there any questions from the floor? Please feel free to ask any questions in the chat. Okay. If we do have any questions throughout the session, please feel free to just ask them in the Q&A or into the chat. Without any further ado, I'd just like to call our next speaker, which will be Mahosi, and she will be giving her life testimony and just sharing about her experience with disability and sexuality.
Okay, good afternoon, everybody. I hope you can hear me. My name is Mahosi, Mahosi Litimile. Sorry, I'm not sure about the slides. They'll follow anyway. So I'm a mom and I'm a sex worker. I'm a disabled, I'm a reluctant activist. I don't like to be an activist, but unfortunately, this is where I find myself. And I'm a sex toy reviewer. So I review sex toys for women with disabilities, and I share my experience online, mostly on Twitter. And it helped me start a conversation about women's health and pleasure. And with my own personal research, because it really involved me and my health, I'm hoping that we can have further research about how our bodies work and how to rehabilitate our pleasure, our bodies using what we have where we are, and also integrating pleasure into our healing. So in my story is that in 2016, I was diagnosed with TB meningitis, and it led me to being disabled. So this was 5 years ago. So I've since regained some of the use of my limbs. However, my main focus was on my reproductive health and recovery. So I was 32 when I got disabled, and I just the thought of having no sex life just wasn't an option for me. I mean, I'm 37 now, so I was online searching for like electronic devices on how to help me, like my nerves, to reawaken my nerves. My thought behind that was that if something can shock my nerves enough to make them more sensitive, then I should be able to feel, because I couldn't feel anything 5 years ago. And somebody suggested vibrators for me. If I'm not mistaken, my first vibrator was from Dr. Tlaleng. And then in 2019, August, I was gifted a bag of toys. They were pre-loved, so somebody had them before, and then they handed them down to me, and I started using them. So in about 6 weeks after I started using my toys, I could sleep through the night without having any accidents. So by accident, I mean, I didn't wake up to a wet bed. I didn't need my linen savers, and I was astounded, So I started documenting my experience online, and I've been able to have the conversation about incontinence and how our bodies can heal with sex, and talking to disabled and non-disabled people and discovering that there are ways that are not necessarily always available to us that we're not told about. So chronic illnesses often disrupt, if not destroy, sexual inclinations, and the treatments that we get to be recommended with are not usually available and are not affordable to the ordinary person. So nobody's talking to women and telling them that vibrators can save their lives and their dignities. I mean, when I was leaving rehab in 2016, had I been told that, if you have an orgasm a day, your incontinence won't be something that you have to live with and that has to embarrass you. And I only had to discover that by myself, by accidentally, playing with my body. So I've also since learned that cancer survivors also struggle with sexual health during or post treatment. So cancer survivors usually don't have a libido or anything like that. And I'm not sure how many people classify cancer as a chronic disability, because then they'd be able to discuss how to manage getting your sexuality back post-cancer treatment. And so because I started using vibrators, I was able to start sleeping through the night without interruptions. I'm currently able to tell when my bladder's too full, and it's something that I wasn't able to do 5 years ago. I can manage my bowel. When I left rehab, 5 years ago, I used to have to drink 16 tablets every 3 days so that my stomach can get cleaned out. Now I currently, what I do drink tablets. I drink about 8 tablets at a time, but I can self-regulate. So I can tell that I need to go to the bathroom, even though, I don't need to wait to see that there's a mess first. So my experience has shown me that there are more ways to heal women's bodies, and we need to include methods that would not otherwise be considered conventional, because I've had discussions about what sex is and how it's defined and everything, and we never really talk about how sex can also be used to heal bodies that are traumatized by life experiences. So because I review sex toys for disabled women, sometimes I get into transactional agreements with the toy suppliers. So I'll tweet about it and then I get compensation. And that's where I identify with sex workers, because I get to orgasm and make money from it. And it doesn't, yes, I'm a sex worker because of that. The ordinary person would think, okay, so a sex worker is somebody that you would see on the streets without walking, or they have an OnlyFans account. So I consider myself a sex worker because people get in touch with me and they send me toys and I review them. And yeah, sex toys being at the center of sexual health and pleasure is no surprise to me. And I hope that the medical field will also consider disabled women when they're talking about life post-disability. Because according to statistics, 1 billion people live with a disability, and then an estimated of that is 1.6 million of them are women. And these are stats that I have for international people, and we don't have down to the number studies for African women with disabilities throughout the ages and the ranges. And because of COVID disabling people, I know that there's more of us out there. So my hope is that going forward, the medical field, not only will it broaden how it defines sexual health and sexual pleasure, and how it integrates healing of women, because society also tends to punish and forget women who get disabled. My hope is that there gets to be more research on how to give women more non-conventional methods of healing for those who can't afford your surgery and your Botox and things similar like that. So that was my experience, and I'm really hoping that we can all go out there and have the conversation about how to better manage disabilities and how to help heal people with disabilities and be inclusive. And when we're talking about being disabled, we shouldn't look at disability as a disadvantage sexually too. So when you're talking to your women in your clinics and in schools, you must also consider that outside of the disability, there's more. There's sexuality that attaches us to our existence. So yes, that's my story. And thank you very much for your time. And if you have any questions, I'm on Twitter and I'm on Instagram as Wheels and Toys, as my handle says on my Zoom profile. Thank you so much, everybody.
Thank you so much for sharing your story. I think more than anything, it's been educative and very encouraging. And I like what you say that, you know, disability is not sexual disadvantage. And so if anyone does have any questions, please feel free to ask them in the chat box or in the Q&A. You can also contact her. She's given her details. For now, I'd like to hand over to my colleague, Ms. Diana Msipa, who will tell us a bit more about the work that we're doing in the Disability Rights Unit at the Center for Human Rights.
Thank you so much, Tadi, and thank you as well to all the presenters that have taken the time to share with us their amazing research and knowledge. And thank you as well to the participants. So I think what this marks the end of the conference. So we're in the final minutes of the conference. So before we go, I'd just like to share with you a little bit of the work that the unit, the Disability Rights Unit at the Center for Human Rights does. So we have a number of programs and projects that we work on, and I'd like to share these with you in case they may be of interest to some of you. So as some of you might be aware, the Center for Human Rights is both an academic institution in that it is an academic department rather, in that it is a part of the Faculty of Law at the University of Pretoria. But at the same time, it also operates as a non-governmental organization. So the nature of our activities reflects our dual personality, if you will. So we have activities that are geared towards, you know, at the academic side, and then we have activities that are more reflective of our NGO personality. So I'll sort of take these one by one. So in terms of academic programs, we offer a very unique master's program in disability rights in Africa. I say it is unique in the sense that it is the first and only master's program on the African continent that looks at disability rights from a rights perspective. We don't only look at disability studies from a sort of philosophical perspective, but we look at it from a rights perspective. So the course is open to people who are both lawyers and non-lawyers. And so if you are a non-lawyer, you will graduate with an MPhil, okay, in disability rights in Africa. And then if you have a legal background, you'll graduate with an LLM in disability rights in Africa. So the program is offered over a period of 2 years, and it is taught in a hybrid format. So the bulk of the learning takes place remotely. So we have students currently that are from all over Africa, so many countries in Africa, from Kenya, from Uganda, from Swaziland, South Africa, Zimbabwe, many African countries. And they undertake the bulk of their learning online. So they'll be studying remotely from their countries, but part of the learning must also happen in person. So they'll have periods where they'll be required to be present in Pretoria in person. And we call these periods block weeks. So there are 3 block weeks in the 2-year period that a person will be enrolled on the program. So it's a really wonderful program. I think it aims to equip people who are interested in disability rights with the knowledge that they need to further the promotion of disability rights in their home countries. So we have a specifically African focus on disability rights, but we also look at disability rights from a global perspective, focusing as well on the Convention on the Rights of Persons with Disabilities. So that's one of our academic programs. And then we we also have a repository on disability rights. So what this is that it's an online resource that basically has information on disability rights on the African continent. So for example, if any of you happen to be doing any research on disability rights in Africa, you can visit the website. It's the Repository on Disability Rights in Africa, or RODRA for short. And there you will find things like academic articles on disability rights, constitutions, pieces of legislation that are relevant to disability rights, sometimes concluding observations, state reports, and the like on disability rights. It's just a resource to try and assist people who are doing research or who want to find out a little bit more about the status of disability rights in various African countries. And then we also run an advanced short course. So the advanced short course happens every year in March, at the beginning of March usually. And it's a short course that is for a week. We call it advanced because within that week, you'll be taught by experts from all over the world, all over the African region in different, they'll teach on different aspects and different areas of disability rights. And at the end of that course, participants get a certificate of attendance. There will of course be an assessment. Usually it's in the form of a moot competition that is then assessed, and then people sort of get graded and then get their certificates. And the short course is really popular. It's a really popular way for someone who's probably not starting from scratch in terms of their knowledge on disability rights, but they want to sort of advance their knowledge on disability rights. We also have projects that we undertake, so these are, for example, we have a project right now that is on public and political participation for persons with disabilities in Malawi and Namibia. We also have a project on access to equal justice in the criminal justice systems in Zambia, Botswana, and South Africa. We also have a project on monitoring the human rights impact of the COVID-19 pandemic on persons with disabilities in Southern Africa specifically. And we also are we have also just embarked on a project on access to justice that deals specifically with the ability of witnesses with intellectual and psychosocial disabilities to testify in courts. And we also have a partnership with the mandate of the UN Independent Expert on the Enjoyment of Human Rights by Persons with Albinism. The new mandate holder, Muluka and Mitty Drummond, and the center, we work together, and we've also worked together with the previous mandate holder as well to promote the rights of persons with albinism on the continent. And then we are also working, embarking on working on the ratification of the protocol to the African Charter on Human and People's Rights and the Rights of Persons with Disabilities in Africa. I think you will have heard my colleague Faith allude to a webinar that is taking place tomorrow on the ratification of the African Disability Protocol from 9 a.m. to 12 noon. And I would encourage any of you who have the time tomorrow to join us. That promises to be a very exciting webinar, very insightful as well, on the importance of ratifying the African Disability Rights Protocol. We have also partnered with several other disability rights organizations from across the globe in a project that, is the Global Coalition on Deinstitutionalization. So what we are working on is we are working to support the Committee on the Rights of Persons with Disabilities Working Group on Deinstitutionalization. So it's all about promoting living independently in the community. And so what that working group that was established by the committee is coming up with guidelines, global guidelines on deinstitutionalization, how member states can go about deinstitutionalizing in an effective way, in a progressive manner. So we are working again to support the development of those particular guidelines. And I think we will sort of put it out there once the guidelines have been completed and adopted. So that's, those are some of the projects that we do as a unit. We also do have a publication, and I think we had invited the convening editor of the publication, the African Disability Rights Yearbook, Professor Charles Ngwena, to come and speak on this. Can I just check if Professor Charles is with us yet?
Yes, I'm here.
Oh, thank you. I think I will hand over to you to speak about the African Disability Rights Yearbook.
Yes, I will only need a few minutes. I don't know whether I can get my video on, but that's not important. I think you saw me yesterday. So it'll just be my voice, because I'm told that I can't start the video. It has been disabled. But to continue from where Diana left, the journal we have is an annual publication called the African Disability Rights Yearbook. So we tend to shorthand as a yearbook. And what it aims to do is in part to complement the conference proceedings, such as the ones we have been having now. It is a forum for publishing your article. Many of the papers, if not all the papers that have been presented, have something important to say, and it would be a pity if you are not able to share that with persons that were not in the conference. So in order for others to be able to know what your thoughts are, and in particular, what your suggestions are, the best way to do it is to publish your thoughts. And the yearbook is a forum for that. However, as a peer-reviewed journal, when you submit your article to the yearbook, we ask for that article to be reviewed by two anonymous persons who will read without prejudice what has been submitted, and after they have read, they will make recommendations to the editors, giving a view of whether the article is publishable without any changes, or whether it is publishable on conditions that some changes are made. And of course, in other instances, they may say it is not publishable at all. But what is important is that reasons are given as to why a paper is publishable, or as to why a paper is publishable only if certain changes are made. So we do encourage you to gather your thoughts, finalize them, and submit your article to the yearbook for consideration for publication. The active period for submitting articles is between the beginning of January 2022 to the 30th of March 2022, and in the last quarter of this year, we will publish through the Center for Human Rights a call for papers that will indicate the submission methods, so that you know who the paper is going to. But we also say beforehand that publishing an article can be a lengthy process. It can take as much as a year. to know about the outcome. So we generally encourage authors to be very patient with us and wait for at least 3 months before they get a feedback, comment about their paper. The journal itself has 4 sections. Section A is a section for articles, and that's the section I've been speaking about. Section B publishes country reports that we commission from specific authors, and Section C publishes short commentaries also that we tend to commission from specific authors. Then the last part of the yearbook is a book review. We ask an author in each year to read a book and advise us what they think about a book, and then we publish that as a book review. So just to summarize, we invite you to consider submitting your articles for publication in 2022 for Section A of the yearbook. I don't think I have much more to add, so I'm happy to give you back to Diana.
Thank you so much, Professor Ngwena, for a very detailed explanation of the African Disability Rights Yearbook, and as well as instructions on how those who are interested in publishing in the yearbook can go about submitting their manuscripts. So at this stage, it is my pleasure and my privilege to welcome our Assistant Director, Dr. Nkatha Murungi, who will give us closing remarks as we close the conference today. Dr. Murungi, you're most welcome.
Thank you, Diana. I also see that I'm unable to start the video because the host has stopped it.
Okay, sorry, let me ask Tiruna to assist with that.
Okay. I'm not sure if we should wait, Diana, or maybe you can let me know. Just a minute.
Dr. Nkatha, can I suggest that you carry on? We are having some technical difficulties on our side with the webinar package today. Please excuse us.
Okay, thank you, Simpiwe. Okay, well, good afternoon, or is it good evening for some of you? So I'd rather say hi, everybody. It's a pleasure to join you at the tail end of the conference, which has been an exciting 2 days. I was here in and out in some parts of the sessions. Unfortunately, because of other commitments, I was not able to join fully, but I am following very closely the presentations that were made, and I think it has been an exciting 2 days. As was mentioned at the beginning of this conference, this is a particularly interesting topic for discussion. And so through the years, we've always had a focus on a specific issue, especially focus on articles of the Convention on the Rights of Persons with Disability and the African Disability Rights Protocol. This is a particularly interesting focus because, as Professor Ngwena said at the very beginning, it's a subject that is barely acknowledged or properly accorded the space and attention that it deserves, particularly within the African region. And so because of that, to have this forum and to have discussions that are very specific about the African context and the peculiar experiences, the particular experiences of persons with disabilities in an African context, I think that makes it a very rich and a very timely forum. I fully associate with the comments that have, the presentations that are made at the beginning of this conference, setting out the importance of having these conversations or having a forum which periodically we review the matters relating to persons with disabilities and spotlight those issues for policy discussion, for influencing, but also to provide an opportunity for cross-learning across different countries. Because looking at the program that we have today and seeing all the presentations that have come, you would agree that we have a fair balance of academic research, policy-oriented research, as well as personal experiences. And all those, they give us an opportunity to know what is going on in other countries, in other spheres, and to enrich our discourse as a region as we continue to build that. Because for many years, and part of the background of the formation of this forum is the absence of such discourse. And so we as the Center for Human Rights are excited, are very privileged to host this forum. And we always look forward every year to this moment in November, where we can host another disability conference. So thank you very much for making that part of the experience good for us, or fulfilling that aspiration for us. I noticed that the sign language has gone off. I think that's important. So maybe I wait if that can be sorted out.
Yes, most likely they're just switching.
Okay.
Yes.
Okay, I see. All right, so I'll proceed by saying that I am aware that it's already 4 o'clock. It's a time when we are supposed to close. I do not want to be long. My comments are going to be very brief. Just further to what I have said, all I would want to present at this moment is a vote of thanks from our side to say thank you to everybody that has made today work, especially those who have worked tirelessly over a period of several months to put everything together, including, liaising with the authors, setting up the necessary arrangements for this, the technical arrangements to make it work, as well as, conceptualizing and leading the thought process behind this conference. To start off, I would want to say a huge thank you to Professor Charles Ngwena. He's always a pillar of strength for us within the center, but especially in the disability rights field, as one of the foremost researchers and trainers on disability rights issues, and for his role in particular in this conference in conceptualizing, or rather guiding the conceptualization of the theme and putting together the documentation, the concept. And we are sincerely grateful that you have stayed up until now, including delivering the opening remarks, as well as making a contribution in research. Professor Ngwena, we sincerely appreciate your time and your expertise and contribution to this conference. Secondly, I would want to sincerely thank the team of the Disability Rights Unit that has worked also tirelessly behind the scenes to make this successful, starting with Diana, who is the manager of the unit, and colleagues there. I believe that majority of you have been in touch with Sabia at some point or the other. Tadiwa Nashe and Paul and Faith and the other members of the team as well, Faith, Mary and Wilson, everybody who has been involved in some way or another as part of the center team to make it work. And that also extends to our communications team that has been working also behind the scenes, managing the technical aspects of this meeting. So with Tiruna and Simpiwe in the background and other colleagues I may not have seen here, we sincerely very grateful for your time and for your input. I would also want to thank the alumni of the Disability Rights in Africa program of the center, as well as the alumni of the Open Society Disability Rights Scholarship Program, who have been assisting us in various capacities with the moderation, with managing the chats, with rapporteuring. We are very grateful to be associated with you, and thank you very much for your assistance in this regard. And of course, I wouldn't say enough for all the people that have made a contribution today in terms of their research, sharing their research as presenters, as well as chairs and moderators of the various sessions. Thank you very much for your time and for your effort. And of course, our interpreters, I think they make it possible for all of us to enjoy and to understand what is going on. And we sincerely grateful to the interpreters for their skill and their time and their expertise in making it possible for us to engage. So on behalf of the center, we hope that you've had a good learning and sharing experience through the conference, and that the knowledge and the community that you have gathered from this forum will not end at the end of this meeting, but rather that you will be able to maximize the linkages that you have made from today, and that you will be able to follow up and engage further so that we can continue growing the community of disability rights practitioners on the continent. So from myself and on behalf of the director, I just want to say thank you very much to everyone, and to wish you all the best as we depart, and hope to receive your article in the Disability Rights Yearbook, as well as to see you in the next Disability Rights Conference next year around the same time. Thank you very much, and sincere appreciation for your presence and your time. Diana, I don't know if that should bring us to a close.
Thank you so much, Dr. Murungi, for your closing remarks and your words of gratitude to all the various people who have taken part in the conference. I think you have said it all, and all I just want to say is a very hearty thank you to everyone, and wishing you all well. Goodbye, and we hope to see you again soon.